Well, Dr. Stephen Hoption Cann is kindly agreed to talk to us, who is a clinical professor, School of Population and Public Health. Is that right, Stephen?
Yes.
Faculty of Medicine, University of British Columbia.
Right.
So basically, I know you've been working on a paper which is sort of challenging some of the almost sort of not quite axioms, but things that are so frequently done in modern clinical practice that when someone has a fever, you reduce the fever. When someone's ill, we try and give them lots of drinks, and when someone's ill, we try and feed them. But you're sort of rethinking this, aren't you? I mean, how would you sort of summarize the argument we're going to be looking at today, Stephen, please?
So my paper focuses on three aspects of fever, basically the fever itself, food, and fluids. And a lot of advice that we give to patients, because sometimes when a patient's sick, you want to give them advice that they can do something to help themselves. But a lot of the advice we give is not evidence-based and is sometimes not useful or even harmful. And, you know, with a severe infection like COVID going around, we're seeing a lot of this, I think, potentially harmful advice being given to people. So the first aspect is fever. This is a part of your immune response, and it's the way the body fights off infections. That, you know, a single bacteria or virus can't rapidly change its temperature, but a human can. And so we can rapidly increase our temperature. Viruses are only effective over a certain temperature range, so it makes it harder to survive in the body. And the higher the fever is generally a sign of a more serious infection. So if you have a very high fever, why turn that off if it's trying to fight the infection? So that's another important point. The second aspect is fluid. You know, people often say, you know, every public health website will tell you drink plenty of fluids when you have a fever. And that's exactly the opposite thing you should do, because when your body has a fever, it actually releases a hormone that retains water. Because normally when an animal becomes sick, you know, it's going to hide in its burrow, try and keep warm. It's not going to be eating or drinking. So if you're not eating or drinking, you want to conserve that water you have. And that's what the body does. Whatever water you have when you get sick, it's trying to hold that in. So if you're holding water and then you're drinking plenty of fluids on top of that, that fluid has to go somewhere. And so if you're drinking, say, water or something like that, generally that fluid goes into the cells. So it can go into the lungs. You know, if you have a cold, you really want your lungs to fill up with fluid. That's not going to help you breathe. It stores in cells in the brain. So people often get headaches, you know, when they get a high fever. A lot of that is due to just doing the wrong thing. And the same with fluid. If an animal is sick, you know, it's hiding in its burrow, it's not going to be eating. And so generally what the body does is it consumes itself. You know, there's stored fats and sugars that it breaks down to fight that infection. Because if you ever had a large Christmas dinner, you know that, you know, afterwards you feel quite tired because it consumes a lot of energy to digest. And so when you have a serious infection, you know, that time that you're spending digesting food is taken away from energy you could spend against the infection, which is the more important thing at that time.
Wow. So basically what we're saying is for the vast majority of people with acute infections, whether that's caused by bacterial or viral illness, it's usually best not to artificially lower the temperature with medicines such as paracetamol or acetaminophen. It's best not to give them too much in the way of fluids. And it doesn't matter if someone doesn't eat for 24, 48 hours for the vast majority of people. Does that?
That's right.
And your contention is that this will have an improved clinical outcome, that they will be sick for a shorter period of time, they're less likely to die. What's the practical outflow of following these three pieces of advice?
Yeah, I think your survival from, you know, a serious illness is going to be much higher. And also, you know, I mean, that's an important part of the immune response is the fever. And when I was first writing this paper, you know, a year ago, there was no such thing as long COVID and people getting staying ill long after the illness had gone away. And, I'm thinking now that, maybe some of that is because we're turning off the immune system right when we're starting to fight that infection. And then that's causing negative effects on, various organs and some long-term effects, that people might be suffering from because they shut the immune system off right at the very beginning.
Wow. I mean, this is, of course, the reason we're doing this interview is this is what I've believed for a long time myself, but it's pretty radical. Most people associate a fever with abnormality, therefore they need to get rid of it. So I think if we start off by looking at fever in a little more detail, Stephen, if that's okay. I mean,
Sure.
how is a fever generated when someone has, say, a viral or a bacterial infection? What's happening physiologically in the body to raise the body temperature?
So it's controlled by the hypothalamus, which controls your regular body temperature. So during the winter time, you feel cold, you're going to put on a sweater or turn up the heat in your room, or wear a thicker coat. But when you get a fever, the body decides, okay, 37 degrees Celsius is not good enough. We need to raise it to, say, 40 degrees Celsius. So now when your body's 37 degrees, all of a sudden you feel cold. You get the chills, you might get shakes or rigors. And so what your body is actually trying to tell you is warm up, go lie under some warm covers, dress more warmly. So it's trying to give people that information, to change their behavior, so that, because you can imagine, raising your body temperature from 37 to 40 uses up a lot of energy. And it's just a waste to use your body's own energy to generate that fever when you can just lie under some warm covers or get a hot water bottle or something like that. So it's trying to give you that information to save your energy and stay warm. But people often want to take, medication because they think, I don't feel well, let's take some medication. But, what's the point of taking anti-fever drugs if it's going to prolong your illness or worsen your illness? Maybe temporarily feel a little bit better, but over the long term, it's not going to help.
So acetaminophen, which is paracetamol, it's exactly the same drug, or Tylenol, it's the same thing. Right. And ibuprofen are common medicines that people take to reduce fever. Will those drugs actually have any antiviral or antibacterial effect?
No, those drugs themselves don't have any therapeutic effect against a virus or bacteria or anything like that. And there are some animal studies to suggest, in fact, the animals survive less well, develop more serious infections when you use those drugs.
So these medicines are treating the symptoms to make someone feel better in the short term, and they do make someone feel better in the short term, but they are actually working against the body's own deliberate attempt to raise the temperature.
Right. Each medication has different mechanisms of action, and with paracetamol, what it does is it causes your peripheral veins to dilate, so you're losing heat. But also, if you're giving that higher doses irregularly to a patient, it often causes a drop in blood pressure. And so to counter that, they will often give the patient more drugs to bolster the blood pressure, more fluids to fill up the veins to try and increase the blood pressure. But all of this is working against what the body's trying to do, and actually can make the situation a lot worse for the patient.
Mm-hmm. I've heard of pyrogens, Stephen. What are they?
Pyrogens are molecules in bacteria and viruses that stimulate a fever. So there are certain conserved molecules in these infectious agents that the body can recognize. Oh, this is a gram-negative bacteria, or this is a gram-positive bacteria. And then that shapes the type of immune response that a person will develop afterwards. So important ways to recognize something that doesn't belong in your body.
And then the pyrogens will be recognized in the hypothalamus, which will just turn the temperature up. Is that the way it works?
Right. So if the body gauges that it's not a serious infection, you might not get a fever, or maybe only a mild fever. If the body gauges it's a more serious infection, you get much higher fevers depending on what how serious it seems, to the immune system.
It's quite incredible, isn't it? And as the temperature goes up, as someone develops a fever, you've already said that the viruses, if there's viral infections, the viral particles won't replicate as effectively. Is that true?
Yeah, it does, because a virus or bacteria, these are like single cells that, they don't operate over wide temperature ranges like humans can live in the Arctic, they can live in the tropics. We can live over wide temperature ranges, but a virus or a bacteria has certain optimal ranges that they live in. So like cold virus usually gets into your nose because you're breathing it out. Your nose is actually a little bit colder. Your nasal passages are colder than the body. So they like to live in those colder temperatures. So when you get this fever, it makes it much more inhospitable to the virus.
And is it the same for bacterial infections?
Same for bacterial infections. There's a certain range that is optimal for them. And then when you get these higher temperatures, it's a little bit harder for them to survive and replicate depending on what temperature you can produce.
So this will probably be related to the enzymic systems within the organism, isn't it? The enzymes are very specific to a particular temperature range.
Right. There's a lot of aspects of their replication and enzyme production and things like that operate in certain temperatures. The body releases certain molecules to protect its own cells and its own immune systems so that they can operate more optimally at higher temperatures.
Mm. So the higher temperatures are uncomfortable for the organism, but what do the higher temperatures do to bolster the immune system of the individual?
Well, also it does seem that some immune cells function more optimally at higher temperatures. Enzymes can work much more rapidly, so there's a little bit of efficiency that goes along with these higher temperatures that seem to be working hand in hand with the fever itself.
And is this the cells in the innate immune system, or are these the cells in the adaptive immune system, or is it affecting both types of immune cells?
It's affecting both. And what's interesting is they did a randomized study in children getting their routine vaccination. So it was a vaccination with against multiple pathogens. And they randomized them to acetaminophen or placebo. And they found that the patients that took the acetaminophen had much less immune response, so less antibodies and things like that they measured gauging immune response. And many subsequent studies have been done in adults and children, and they'll show the same thing. If you suppress the fever with acetaminophen or ibuprofen when you're getting a vaccination, you get a very much inferior immune response to that. So we know that the fever is going hand in hand with the immune response, guiding that action against these pathogens, which is important when we think about the COVID vaccination. Do you really want to take acetaminophen, beforehand or afterwards? If you're getting that vaccination, are you going to get as good immune response? Probably not.
So this febrile response is enhancing the immune response for natural infection and enhancing the immune response that we get to artificial immunity, which is basically, I guess, what vaccination is. And yet routine advice, even from doctors all around the world, seems to be to reduce fevers if you're ill, or to take ibuprofen, paracetamol, acetaminophen after a vaccination if you have a febrile response. So this is basically contradicting a lot of official advice around the world at the moment, isn't it?
Yeah, I mean, we've traditionally said that, fever is not that important. It doesn't make a difference. But actually, there is a wealth of studies, some studies in humans, but mostly in animals that show that it is quite important. And if you look across the animal kingdom, all mammals produce fevers, all birds produce fevers. And then you've got some animals that can't alter their temperature, like reptiles and amphibians. They can't alter their temperature, but they can move to a warmer environment. And what we see is those animals as well have a febrile response. If they become infected, they'll move to a warmer environment. A snake will go somewhere in its burrow or somewhere in the sun to heat its body up much higher than it would normally when it's healthy. And we also see this in fish and even insects. So, you know, you look across the animal kingdom and all these animals are trying to generate a febrile response when they have an infection, but humans are the only exception. They're trying to bring it down.
We're the only ones that bring it down, absolutely. So this is quite incredible. All mammals generate a febrile response when they have infections, or all birds do.
Yes.
And quite a few fish and insects, and as we've said, reptiles, lizards, snakes, seek to increase their body temperature via some mechanism. So what that's saying to me, Stephen, is this is a massively highly conserved characteristic. Does that relate to what you're saying?
Right. It's, you know, it wouldn't spread this, because if you look at it, it's a huge metabolic cost for a bird or a mammal to generate that energy to increase its body temperatures. So, you know, why would it have that huge metabolic cost during an infection unless there were some significant benefits of that response?
Now, if I have a metabolic deficit, I'll go to the kitchen and make myself a sandwich. It's not too difficult. But in the survival situation, spending that amount of energy to increase the temperature could be the difference between dying of starvation or surviving. It's a massive thing in a natural environment, isn't it? So for an organism to use such a lot of energy to generate a febrile response says to me that this febrile response must have a really significant purpose and adaptive advantage. Yeah,
for sure. And you know, there's a concept, they call it sickness behavior. And a lot of behaviors that an animal has when it's sick, you know, they used to think, well, it's debilitated from its disease, but what they've come to understand is this sickness behavior is actually behavior that helps them overcome the infection. So, you know, maybe they're not grooming themselves like they normally would, so they look pretty scruffy during an infection. But, you know, it's not so important to groom yourself if you're an animal, if you're wanting to spend that energy to fight the infection instead.
Absolutely. So if this had been a deleterious feature in animals, it would have been selected out by natural Darwinian processes millions and millions of years ago, because it's conserved in every branch of the evolutionary tree.
Right.
Yeah. Means it's had an advantage in every single branch of that tree, and it's a survival advantage. So an animal that develops a fever will be more likely to survive, therefore more likely to reproduce, therefore more likely to pass its genes on. I mean, that is pretty convincing argument to me. But what people always say to me is, but fever's dangerous. What happens if my fever goes too high? So what do I say to those people?
So, I mean, you have to differentiate between something like fever or heat stroke. Like if you're out in the hot sun during the day and you just become faint or something like that because of the high temperature, you know, that's the environment that's controlling your temperature, not your body. But in the fever, the body is controlling the temperature. And they've done studies and they've shown that if you don't do anything with the fever, most fevers won't go beyond 40 or 41 degrees Celsius. Above 42 is extremely rare. So it's not like if you don't treat it, it's just going to keep going up and up and up. And there's going to be this huge danger of brain damage or something like that. In fact, the body is quite in control of the fever. But it also means that you support that fever appropriately. So keeping warm is a good thing. But you don't want to keep too warm. Like you don't want to be putting so many blankets on that you're sweating, you know, and drenching in sweat, because now you're not following the clues the body's giving you. You just want to keep your skin warm and dry. And during a normal febrile infection, the fever goes up and down and up and down. It's kind of like, you know, an army fighting. You know, it thrusts and it attacks, and then it might pull back a bit, and then it attacks again. And so the fever has this complex pattern where it's going up and down. And so you just have to support that. If you're feeling cold, put on more blankets. If you start to feel hot, take those blankets off, because that's the normal pattern, is this up and down of fever.
So the way I feel when I'm sick is very much a product of my physiology and neuronal circuitry that's actually hardwired into my brain with synapses that use specific chemicals that are actually in the very structure of my brain that are controlling this very thing.
Right. Yeah, it's
not an accident.
I mean, we don't second guess, how many immune cells the body produces or the type of immune cells, but we try and second guess the fever. It doesn't know what it's doing in terms of fever, but in fact, this is quite highly regulated response as it's going along against the infection.
And is promoting the function of the immune system and making life very uncomfortable for the pathogenic microorganisms or viruses that are causing the infection. Now, I'm very happy with that in adults. I've looked after many adults with fevers of 40 degrees centigrade, and they don't seem to come to any harm, even 41 degrees centigrade. So if me as an adult, if my fever was 41, 42 degrees centigrade for a period of time, I'd feel pretty awful, but it's not actually damaging my body tissues. Is that what you're saying?
That's right. Yeah.
Yeah. Now, what about children? How are children different?
Well, for a small child under 5, they're a little bit different from adults because they have a very large brain size relative to their skull. Their skull's still kind of small relative to their brain. And so there is, on the rare occasion, the development of febrile seizures during fevers. And so people become concerned, and they've studied this, and they've shown like the seizures that occur during fevers are largely harmless. But they have done a lot of studies looking at randomized trials where they treat patients with anti-fever drugs or placebo. And they found that in these studies, it doesn't help prevent seizures, it doesn't help treat seizures. So that's something to consider. But the other consideration is, how much fluids you give that child, because the more fluid you give, that again is stored in the body, and it has to be put in somewhere. And so that can go into the brain cells. So actually, if you give a child like a lot of water to drink and they're having a fever, the brain will swell, and actually you increase the chance of that child developing a seizure.
Wow. This is what we call cytotoxic cerebral edema, isn't it?
Right.
Where the individual cells swell up. Before we go on to that, though, I was taught, and in fact, it was drummed into me when I was a student, that children under the age of 2 can't efficiently control their body temperature. They can't efficiently thermoregulate. Therefore, for example, a 1-year-old child with a fever, the fever could keep going up and up and up until it would potentially damage the proteins in the brain. What's the current thinking on that?
Well, again, it's the body that's controlling that fever. Obviously, if a child is, when the fever's going up, you don't want to, have them overheat by giving them too many blankets, but, you just want to work with that, that change in temperature so that they're comfortable. But generally, it's, again, just like adults, it doesn't keep rising and rising.
Right. And that's true even under the age of 2.
Right.
So actually, babies are actually able to control the body temperature, whereas for generations, people have been taught that babies can't control their body temperatures effectively.
Not to the same degree as an adult can, but sort of a developing immune system there. But in general, a fever, if appropriately managed, is not dangerous to that child. Certainly not as dangerous as the infection it's fighting.
I think this is one thing we tend to forget, because we've been brought up in an era of antibiotics. We forget that the most common cause of death throughout human history has been infectious disease. This is what people die of, and that they are dangerous conditions. So that's I'm pretty convinced by your fever argument there, Stephen. There's lots of good evidence for that. What about the fluids? Let's go on to thinking about fluids. If someone has an acute infection, What's your thinking about fluid, giving fluids, fluid resuscitation, drinking large amounts of water? Maybe first of all, if we talk about how the body responds physiologically when there is an infection and when there's a febrile response, what physiological or pathophysiological changes occur in the fluid management systems of the body as a result of that infection?
So when you have an infection and fever, the higher the fever, the higher your fever goes, the more the body releases a hormone. It's called antidiuretic hormone. And that hormone has the job of keeping water in your body. And so the higher the fever, the more water it's going to keep in the body, the less you're going to urinate. So the whole goal of the body is to conserve water during a fever, because, you know, if you're debilitated, normally you wouldn't be eating or drinking if people weren't otherwise giving you advice. People often, you know, when you're sick, you often don't have the same food, doesn't taste as good. You're not as thirsty. But that can vary depending on the type of infection. If you have cholera, where there's a serious amount of diarrhea and you're losing a lot of fluids, you can't just keep not drinking, but you have to drink the appropriate type of fluid, because if you're a cholera patient, you have diarrhea and you're drinking water, that will kill you, because when you're losing those fluids, you're also losing electrolytes. And so it's important, if you're going to replace fluid, you have to replace those electrolytes as well. And
this is what we call oral rehydration salts, isn't it?
Right. So, you know, if you have COVID, you're probably not losing a lot of fluid, but some diarrheal illness, you might be losing a lot of fluid, or if you're vomiting or something like that.
So we're differentiating here. So respiratory infections, we probably don't need to take extra fluid. Gastrointestinal infections, where there's a fluid loss, we do need the fluid, but it's better to take it with associated salts and electrolytes as well as just pure water.
Right. If you're taking the wrong type of fluid, you're going to be a lot worse off.
Because if you drank pure water, presumably that would affect the osmotic potentials in the blood, wouldn't it?
Right. So, I mean, your blood is actually fairly salty. And if you just fill your body up with water, you know, and you're losing electrolytes, eventually your body just can't function properly. The cells swell, and yeah, you can die from that.
Yeah. So for acute respiratory infections, if you gave someone large amounts of fluid, for example, intravenous fluids, you would have more fluid in the body. Could that potentially increase the amount of fluids collecting in the alveoli, for example, as occurs with acute respiratory distress syndrome in COVID, severe COVID disease?
Well, it depends on the type of fluid. So when you give patient IV fluids, you're generally giving fluid with electrolytes, but it depends on the sodium concentration of that fluid. Is it isotonic fluid, the same concentration as the blood, or is it hypotonic, which is a lower concentration? So if it's a lower concentration of the blood, what happens is that excess fluid goes into the cells. If it's the same or higher, the fluid gets drawn back into the bloodstream. So basically, when you're shifting fluid into the cells, that's when you get a lot of side effects. People get more difficulty breathing, they get headaches, they get nausea, vomiting. So that can get a lot worse if you're not using the right type of fluid.
Right. So in a respiratory tract infection, for example, it would be acceptable to give, say, 0.9% normal saline, which is isotonic.
Right. I mean, but these are hospitalized patients.
Yeah.
You know, a person at home is not going to be worrying about that. But, you know, at the start of an infection, you don't want to overhydrate, because what we see with serious lung infections, we saw it with SARS, we see it with COVID. Often patients come to the hospital with a condition called hyponatremia, which is a low blood sodium. And that low blood sodium doesn't just happen because the person's losing a lot of sodium. It's usually because they're taking in a lot of fluids, which dilute the blood. And, you know, when you come in with hyponatremia, your risk of a poor outcome is much higher. So, you know, you want to avoid that, certainly from the beginning of the infection.
So hyponatremia, low salt in the blood, more fluid will go into the alveoli, more fluid will go into the cells. And as you said, more fluid will go into the brain cells, potentially
That's
causing.
right.
Yeah. Fascinating. Now, I have always been taught in chest infections, and I'm very happy to reverse all of this, but I've always been taught that you give plenty of fluid in chest infections, because if you restrict the fluid in chest infections, this is going to increase the viscosity of the mucus in the mucociliary clearance system. Does that, I mean, that's one of those things that kind of makes sense, but is there any sort of scientific evidence for that? Any scientific rationale for that?
No, there isn't any scientific evidence for that. And traditionally, patients with these infections would get more generous fluid intake, but they found over time that the patients that were getting the generous fluid intake were doing a lot worse than the patients that were getting the more conservative fluid intake. But it's taken a long time for those changes to happen. So now when a patient's ill, they're a little more cautious with how much fluid is taken in. But, it depends on what you do beforehand before you get to the hospital.
Sure. And this, of course, is the ultimate proof. I can make up any imaginative, very neat physiological rationale in my head, which may or may not relate to reality. But if the empirical data from actually looking at groups of patients that are given small amounts of fluid and large amounts of fluid, if there's a difference between those groups, that is the evidence, isn't it? This has to be based on empiricism.
Right. Yeah. The lungs fill up with water, and it's not really helping the patient in the end.
Wow. So in acute respiratory infections, best to let the fever do its own thing. The body knows best what it's doing. Best not to overhydrate the patient, because we don't want the blood to be diluted. We don't want water going into the alveoli or into the cells where it's doing no good. So, and presumably, eventually, though, the patient will start feeling thirsty. Then it would be appropriate for the patient to drink when they feel thirsty.
Right. So, the body's giving you those clues. So,
yeah.
If you're thirsty, it depends on how much, usually if you're lying in bed, you're not losing much fluid there. So you don't have to be worried like, oh, I need to keep this patient hydrated. But if they are thirsty, make sure it's ideally to use fluid with electrolytes in it is better to take.
Yeah, in hospital, we have this quaint old expression, push fluids. And sometimes we push fluids plus, sometimes we push fluids plus, plus, plus. It's sort of supposed to reflect the amount of fluid pushing that we do. But what we should be doing is listening to our patient and just letting them drink if they're thirsty and asking for fluids. If not sort of foisting fluids on them as a pseudo therapeutic.
Right, because the fever goes up and down, and sometimes the fever will drop rapidly and the patient will be sweating profusely, losing a lot of fluid there. So sometimes that fluid loss is excess if they've been taking a lot beforehand, and sometimes they're losing some essential fluid just to try and cool themselves down. You look at a lot of older movies about, how the person had a fever and then the fever broke and the patient, is okay because the fever broke. So, back then they let them have the fever, and once it broke, they were fine and they recovered. But, if they've lost a lot of fluid, you want to, salt sweat is salty. So you want to replace that with electrolytes if they're going to drink, if they're thirsty.
So what's called the crisis point, isn't it? The point at which the fever first starts to go down. Good. So basically, I've been teaching student nurses the wrong thing for the past 30 years. I'm going to have to amend my notes on that, and that's quite a serious point, because most people are still teaching that you should encourage fluids in any form of respiratory infection, whereas what you are now saying from the data you've looked at is that's just going to give you soggy lungs.
Right. And I wrote another paper on that previously, specifically looking at fluid during febrile infections.
And of course, we'll certainly post all these links. That would be excellent. What about food? if someone's acutely ill, regardless of the cause of the infection, what's the current thinking on feeding them, not feeding them, types of food to feed them?
So there's this old expression, feed a cold, starve a fever. And if you search the internet for the interpretation of this expression, sorry, I just got an interruption here.
There.
Okay, so if you're the interpretation is that you should feed a cold. Like if you have a cold, just eat as much as possible.
Just eat, yeah.
And if you have a fever, maybe you have to starve. But if you look at the older interpretations of this expression, from the 1800s and earlier, there's a lot of talk about how people have been misinterpreting this expression to do exactly the opposite. And the older interpretation is basically, if you feed a cold, you're going to have to starve a fever later, because feeding a cold makes it worse. It's kind of like an expression like, spare the rod, spoil the child. They're not saying don't discipline your child, but you should actually spoil them. It's basically, if you don't discipline them, then you're going to end up spoiled. Or lie down with dogs, wake up with fleas. They're not encouraging you to lie down with dogs to get fleas. They're saying, if you lie down with dogs, you're going to get these fleas. So people have misinterpreted this expression. And there's some ancient writings on here by ancient medical historian Celsus, which I talk about, who talks about, people eating heavily during febrile infections, and people waiting till after the fever's gone. And they seem to do better if they're not eating. And so what we've seen physiologically is that when the fever's higher and higher, what happens is your gastrointestinal tract starts to shut down. So you're not producing the acid, you're not moving the food along. So it doesn't want to take food anymore. And often when people are ill, they don't have that appetite that they would when they're healthy.
So if I eat a large meal now in a healthy condition, does that use a lot of energy to digest that meal and to metabolize the products of that meal?
Yeah, it uses a huge amount of energy to digest. In the end, you'll get more energy than what you're using, but it does use a huge amount of energy, and a lot of people feel tired after a heavy meal, and that's just because you're using a lot of energy to digest that.
But if someone is using a lot of metabolic demand to generate fever, then that is basically an energy reserve that the body doesn't have spare at that particular period of time. It can just use its reserves for that period of time.
Right, because you're not just generating fever, you're producing immune cells and a lot of other proteins that are signaling the molecules, or signaling your cells to fight this infection. So there's a lot going on, and normally what the body does is shuts down the gastrointestinal tract, and it uses its stores of fat and sugars to break down to power that response. And a lot of times the patient, if they're really ill, they'll try and eat anyhow, and then they'll throw it up because the stomach is not working anymore. So the body will just spew it back. It's trying to tell you, look, this is not the time to eat. Wait till your fever's down. Maybe your appetites come back. You can have a little food.
Mm-hmm. So to put that more technically, what we're saying is it is quite normal to become catabolic during acute infections.
That's right. Yeah.
And people with acute infections also have a lot of muscle loss, don't they? They break down a lot of protein to produce antibodies in the immune response. But as you say, if the gastrointestinal tract is not in a position to accept food, then there's not much really you can do about that. I think we just have to realize that this catabolic state of breaking things down is normal, that there will be a period of weakness after that. That's why we have this old-fashioned concept of convalescence, that you could be weak for a while after an acute infection. And that is basically part of the body's normal response.
Right. They've done some animal studies showing that, they did a study in mice with malaria, and they showed like what happens if it loses, say, 1 or 2% of its body weight, or 2 to 3%, and or no body weight loss. And so they had these different levels, and they looked at survival from this infection, and they showed that, yeah, you need to, these animals that lost a certain percentage had the highest survival, but if they lost too much weight, then they had a lower survival. So there's kind of an ideal spot in which you're going to be losing a little bit of weight to overcome that infection, but not too much.
So it's as if you are supposed to lose a certain amount of weight. There's an optimum.
That's right. Your body's using its own reserves to fight that infection, because you're digesting food. In the time that you've digested your meal, you're being overcome by that infection.
Yes, absolutely. If you use the energy to digest the meal, you'd have no energy to generate the fever. Therefore, death becomes a possibility.
It's kind of like if you're in a fortress and a castle, and you have this enemy force coming towards your castle, and you think, okay, we got to defend our castle. But then you look at your watch, it's 6 o'clock, and you think, well, it's usually when I eat. Why don't we just go to the dining hall and eat our meal, and we'll have that energy to fight when the meal is over? And so they go to the dining hall, and then the castle is, the ladders come up and the castle's overtaken, and they had their meal, but they lost the battle there.
I haven't heard that analogy before, and it's a really good one. That is an excellent analogy. Now, the thing I like about this idea is what we're saying is any infection, the febrile response, the body naturally retaining fluid and us not giving too many excess fluids, and us not giving people food when they're in this catabolic state, this is going to help the body survive the entire spectrum of infectious illness.
And I think I think it's very important that this is done sort of from the beginning, because as I mentioned, those vaccine studies show that's when your body is shaping that immune response against the virus. It's producing the antibodies, it's producing, various T cells and other immune cells that will fight that infection later on. But, it's that initial point where it's really shaping the immune response to this totally new pathogen it hasn't encountered before.
So it would have been very interesting, wouldn't it, for phase 3 studies on vaccines to take into account whether someone had artificially reduced their fever or taken antipyretics after their vaccine, as opposed to people that hadn't. Because what we would find, or the very strong hypothesis of what we would find here, is that people who have not artificially reduced their fever got a stronger immune response.
Right. Yeah, that would be a very interesting study to do. And even with the COVID vaccines that are going out now, that's something they can look at is, are the patients that take these anti-fever drugs getting a lesser response or more likely to not gain a protective response at all.
So this thinking would say, well, hey, would you like to increase the effectiveness of your COVID vaccine? If you'd like to increase the effectiveness, don't treat the symptoms while you're generating the immune response. Let the body do what bodies have been doing on this planet for 500 million years now, and get it right. It's fascinating. Just one final question, Stephen. There's so much interesting stuff there, but you mentioned historical characters a few times. Do you think as a modern researcher you've got things to learn from medical thinkers in the past, scientific thinkers in the past?
Well, if you look through history, fever's gone up and down, where people said it's a good thing, people said it's a bad thing, and it's changed throughout history. And actually there's an old English expression, a spring fever is a physic worthy of a king, which basically says if you get a fever in springtime, it's just as good as getting the king's own medicine, because a lot of times there'll be reports of cases where a patient had this infection and they had a high fever and whatever, and it also eliminated some other illness they happened to have that they had chronically. So people don't realize, how good an infection like this or a fever like this can be, just to, not just to that immediate infection, but other health problems as well.
It's
kind of
yes, that happened to be there. Absolutely. So basically, the body knows what it's doing. So if you take malaria, for example, when someone develops a very high fever, the sort of pyrogens that are being produced by the immune system in response to the malaria parasite, it recognizes that a particularly high fever is needed, and then the appropriate febrile response is generated. Is that kind of what the thinking here is?
That's right. And actually, we've done a few randomized trials in malaria and shown that if you take the anti-fever drugs, actually the course of infection is much longer than if you didn't take any anti-fever drugs. So it just shows that, you know, you're really hampering your immune response if you're taking these drugs. And it just takes longer for the immune system to figure out how to fight the infection.
You know, I've just thought a fascinating study here would be to review people with COVID-19 infection from the current pandemic. Note which ones give these symptomatic fever reducing treatments, and see how that relates to the prevalence of long COVID in those people in the future. And from what you're saying, we would hypothesize that people who treat their symptoms to lower the fever, who don't let the body have its own physiological immune response, they would potentially get more long COVID, causing a greater long-term burden of morbidity into the future, potentially even organ damage.
Right. And the problem is trying to find people that didn't treat the fever, because, you know, the public health advice is just treat the fever and you'll feel better, and it's not going to make a difference. So, you know, it's hard to find the people that had the higher fevers but then didn't treat them, because the public health advice is just not there.
And I was going to read this paper in great detail to prepare for this again, but I've read parts of it. It's very well written. It is absolutely packed with evidence. The evidence base for this, to me, is now conclusive. The evidence, what more? The evidence is for all of these things you mentioned. Very, very high evidence base. Why do you think it is that a lot of public health bodies are not moving with the evidence base on this? Why are they stuck in the past?
I think a lot of it is due to the fact that a lot of this research was done in the past. So there were a lot of studies done in the 30s, the 40s, the 50s, looking at the effects of anti-fever drugs and survival in animals with infections, or the effect of temperature, you know, putting an animal at a higher temperature versus a room temperature, and showing that the animals at the higher temperature survive longer from a variety of infections. And a lot of the modern studies, they sort of morphed into looking at reptiles and fish and insects and things like that, which don't seem so relevant to humans. And that information just hasn't been pieced together to show, you know, what benefit could be achieved in humans.
But I think that argument about the highly conserved nature of the febrile response is a really convincing argument, actually. It's part of it. Stephen, that is fascinating. We're going to put links to all of your papers, of course, that we'll encourage people to look at. I think there's messages here for the lay person at home. I think what we can certainly say is think twice about reducing your fever. Don't foist huge amounts of fluid on people that might not want them. Don't foist food on people that want them. These things are perfectly normal during a fever. But I also think there's so much for public bodies to take on board here, and individual clinicians. Because, you know, even just in my recent clinical practice, you come across so many people that just don't seem to understand this basic difference between the symptomatic treatment and the causative treatment. So, I mean, I think that's definitely what you're saying, is it? So, if someone had a bacterial infection, you'd want to carry on treating the cause of that by giving the antibiotics.
Right.
We're talking about treating the symptoms here, and it's that quick fix, isn't it? You know, if I've got a patient who comes in with a fever and they feel awful, and I give them a gram of paracetamol or acetaminophen, they'll feel better straight away, and they'll think I'm clever because I made them feel better straight away.
Yeah, we have so many drugs that we use to treat symptoms. I mean, if a person's sick and they're not coughing, we can take a drug